Hi, this is Doug Drescher from TEDxAsburyPark, and I'd like to welcome Ganes Kesari to the forum. Good afternoon, Ganes.
Hey, hi, Doug. Good afternoon.
So those of the people tuning in who know TEDxAsburyPark know that you gave a really wonderful TEDx talk last year about biodiversity, but the world has certainly taken an interesting turn, and now we're really looking at data and the collection of data to provide us some answers. It seems to be all we talk about, no matter what channel news program you watch. You founded and you're part of an organization, a company called Gramener, and how you're turning data into a visual that the rest of us can understand.
Sure. Yeah. Gramener, we tell stories from data using insights. So firstly, the reason why do we need data stories? We've been using spreadsheets for a few decades, and humans have been using numbers for maybe some centuries, but we've been thinking and communicating in pictures for thousands of years. Our brain processes information visually. So the power of visual communication through data is immense. And I co-founded Gramener about 10 years back, and the primary intent was to simplify business decision making and ground it in data.
So up until, say, 3 or 4 months ago, the general population really didn't concern itself with business decision, data-driven decisions, for lack of any graceful way to say it. And now we're hearing terms like contact tracing and data mining and data monitoring, and the word data is being used all the time. How does generating that data now affect us as a human species?
Yeah, great question, and very, very relevant in these times. Before I get into the current situation, I would like to give an example about why data, and particularly data stories, are powerful and can save lives. This is from the Crimean War, a very popular story where as the British fatalities were mounting, the government is putting more money into better ammunition. And there was Florence Nightingale. She started collecting data and looking at the different hospitals and then the mortalities there. And what she found was very stark. She found that the number of deaths from wounds in the battlefield were a tiny proportion, and most of the deaths were happening in the hospitals due to diseases which could have been prevented. And she converted this into a visualization. It's a very popular one called the Nightingale chart. And with that, it was visual, and it was very easy for anyone to spot, say that, okay, this is where we need to be putting in our money. And that led to a massive improvement in sanitation and the healthcare facilities. And that brought down the deaths in the wars the 12 months after that. So that's a great story on how data and visuals can save lives. And now coming to today, where we are in these kind of crisis situations with the pandemic around, I see that one, there has been exceptional data storytelling in the last couple of months. In spite of all the gloom that we are seeing around, if there's one good point there, we have seen very good stories and very good communication. Imagine a few years back, if and there have been several crises earlier, several infections and spreads. People generally talk about the actions which the citizens need to take. For instance, they could have as well said that self-quarantine and stay at home. But now, in the last 2 months, we've been hearing different terminologies. For instance, we've been hearing one term we've been hearing a lot is flattening the curve. Right? So all the leaders have been talking about how the charts could be exponential and how we need to bring it down and flatten the curve. So that's essentially data storytelling, where they say this is where we could have gone and we need to take these actions to bring it down. And hence, we need to do these actions, which is like stay at home and social distance and so on. So this is all tied to data. And even today, when we look at what is the state, all of us go and look at some visualization to find out what is the spread of infection and what is the mortality and so on. So data has a very important role to play today. And in terms of the communication and all of the messaging, it's good. Now, coming to the second part of your question, which is on contact tracing. So that's one area where data and analytics have been useful in these situations. So with the level of contagiousness of this disease, so there's a high risk that anyone who's infected, if they have been in touch with a certain number of friends or other people, they are at risk. So contact tracing is simply identifying who all an infected person has been in touch with or in close proximity for the last week or last week or two, because that's the kind of the time during which the infection could have been active. So that could be done manually, where you ask people, interview, and do it the slightly more painful way. But it is possible. That's how people have been doing it for decades. Now with data, it is possible that you can use some slightly more novel methods to identify who all a person might have been in contact with. It could be through the use of wearables in some countries where government has provided some wearables, right? So with that, they're able to identify that what are the places they visited. Or it could be slightly using slightly more intrusive methods, like using apps on the mobile phone, or in some places, looking at the complete mobile signal as well. So it depends on the regulations, depends on what we consider as a violation of privacy and what is essential for ensuring essential to save lives. So based on that, data can help us to identify who could be at risk and where it could spread next.
The other aspect of the data that I've been hearing about, and I've experienced this when I've gone onto a site like Amazon.com, and I get the warning that because of the shipping and supply and demand issues, that I'm not going to get overnight delivery. How does this sort of data visualization help these huge organizations, the hospitals, the medical providers, even the people who, or the companies who transport these things? How does that help them make decisions with the supply chain and the supply and demand?
That's a great question. Supply chain is one of the first areas to have been impacted with the global lockdown, given that there are materials procured from different countries. So with data, it is, again, possible to identify what is your level of exposure, not just from your supplier, but if you go down 5 levels, 4 or 5 levels, and look at where is your supplier buying his goods from. So it is possible to identify the chain of impact. And that's one way to be prepared. And second is, after items come in, and assuming there's a shortfall of one of the raw materials, so you obviously can't maintain the same level of production. So what do you produce now? Which customers should you serve? So all of these are decisions which you can drive using data, based on either aspects such as like what is optimal mix, what will give you better margins in these times, or which customers you want to really maintain service for.
When we're in school and we're in science class and we talk about data being empirical, that it is what it is.
Right.
But we seem to have a problem where there's a growing movement of people who are distrustful of data, that they believe that their intuition is more accurate than what the numbers are saying. Why is it that data has become so politicized? Why is it that so many people seem to think that they know more than terabytes of information that show us the trends and the directions we're going?
Yeah. So one simple answer to that, I'll expand on that. A simple answer is data can help you if you're eager to find the truth. So if you've already made a conclusion and you're pretty sure about that, then there's little that artificial intelligence or any form of data technique can do to change your opinion. It's going to be very difficult. We have seen this resistance all the time in many organizations, where there are certain executives who either have been so used to acting from the gut, or they don't want to tell a different narrative, that they don't want to use the data. And a similar thing is playing out now, where whether it is in terms of the public, where they think that either because they don't see many people around them infected, or they have a false sense of invincibility, either because of the age group or lot of other factors, what they're reading in the news. Or there could also be a sense of fatigue setting in, like after months of hearing about COVID and being inundated with the stories. So there's also a social or a psychology angle to it, where people, given the months of lockdown and isolation, probably they're starting to behave a little differently. And I read recently about an expert who said that when people incur losses, like in the stock markets or in situations, they get into risk-seeking behavior. And now, with isolation, there's also a sense of losing out on either economic opportunities or social opportunities. And maybe that's also setting people in a risk-seeking behavior, which is like probably venturing out. So there are several angles to it, but if someone is looking for data and looking for insights and has an open mind, like you mentioned, there are gigabytes of data or terabytes of data out there which show exactly what every country has gone through and what has worked, what has not worked, and what is the risk level for us now and a few months later. So I think it is up to us to have an open mind and look at that to take our decision.
What's next for you and the data that you produce and give comment to?
Sure. One, from the COVID situation, yes, we have been involved in, like I mentioned, both these use cases. There are some governments where we have been helping out with a variety of initiatives in terms of helping them take the right decisions with contact tracing and with supply and demand forecasting in terms of what elements or what devices are needed. So we have been doing that, and also with our clients, with our enterprise clients. So that's something which we see a greater need for. And while we do some of these as part of our engagements, there are others where we're doing like a volunteering and doing it pro bono to help the communities. So which we will continue doing from Gramener.
And when you first, I guess it started around December, January, when we started hearing about the COVID. When did you realize and have that epiphany that this was your area of expertise, that you'd be in a position to help in any way?
Okay, that's an interesting question. So this was, in fact, there was a kind of a light bulb moment in March. It was, I think, March was where it was spreading to most of the countries, US, India, and other geographies where we have been operating in. So sometime in March, I got a call a little late in the night, just I was about to hit the bed. And this was from a friend who runs administration with the government, state government in India. And I could sense that there was this panic in his voice. So he was talking about this infection spread and how there might be some urgent support needed. And at that time, compared to now, things were even more open and people weren't sure how many were infected, what was the testing procedure, and so on. So, so his call was very simple. So he said, we need support immediately, and we want to be better prepared, and it is going to take quite some time for us to organically build this response. So that very night, a couple of hours, we internally got together, we pulled together a team at Gramener, and then that night, 1 a.m., we had a huddle with this is the Indian government, with some officials, and we had our first meeting to get the team started. And so this was in a couple of hours we got started, and for the last couple of months, this has been going on, and this has been a great partnership in terms of helping them take decisions. And this is part of a volunteering reach out effort where we wanted to support. So since then, we've been kind of on our heels supporting and working with our clients.
One of the news reports that I saw in the last few days was saying that the first cases of the COVID are starting to be seen in refugee camps in the Middle East, Asia, and Africa. How do countries or just areas in the world that don't have the infrastructure, how do they access, or how do they collect the data? And if that's not going to be good enough, what does the rest of the world need to do to create the infrastructure so we can collect this data?
Yeah, so that's a very important question, given that we don't have the same level of digitization in other countries or access to digital devices. There are many countries where obviously there's going to be a difference. If someone has access to the technology, it's going to be easy to control, monitor, and respond. Whereas in the absence of that, in certain places, we've observed that in some regions, there are largely volunteer-driven manual efforts, where there are people going door to door to check and make notes like journal the entries, and then come back to a central place and then use the mobile phone, a simple mobile phone, to upload the data as simple as text messages. So you don't need some of the smartphones or advanced devices. You can just key in these. It goes and gets collected in a central place, which then can be used by a central administration to use the rest of the tools to do it. So some of these manual efforts, volunteer-driven ones, and so this is going to be very crucial in those parts of the world where they don't have access to technology.
Well, thank you so much for spending a few minutes with us. It was a pleasure to see you again, and perhaps we'll see you back on the TEDx stage again soon as the topics of data become even more important in our ability to move forward into the future. Thank you so much for spending that time with us.
Thank you, Doug. It has been a pleasure.